Hello everybody, I hope you are doing great today. In this video I want to talk about Amarin Corporation, have a look at what they accomplished so far, the struggles and challenges they have or had, where they are today and what may lie ahead. As a disclosure, I am long Amarin since about 3 years. My average cost is around $8, so I am still in the red, but I am a long-term investor, except for some swing trading now and then, but mostly a long-term investor, so those up and downs don't really bother me. It is all about risk management. One of my rules is to never hold more than 5% in a single stock in my portfolio. As a disclaimer, I'm not a financial advisor. This video is for entertainment purposes only. Please do your own due diligence if you're interested in any stock I talk about on my channel. But now let's get back to Amarin. Amarin is a pharmaceutical company based in Ireland. Their CEO is John Thoreau. Since 2009, he basically has been at the helm since it all started, basically. Now the only product is VASCEPA. What is VASCEPA? VASCEPA is pure EPA or iconsapent ethyl. I hope I pronounced that correctly. EPA is derived from fish oil. Many compare it to the omega-3 nutritional supplements you can get at Walmart or online, which in my opinion is nonsense, because those supplements, they contain DHA and maybe some other ingredients that may do more bad than good. But basically DHA, while it has its benefits, but one thing it does, it increases the bad cholesterol, and the bad cholesterol is not good for your heart, and that's why EPA, 100% EPA has shown to decrease CVD risk. The original indication for VASCEPA was the reduction of triglyceride levels in adults with very high TG levels, and this indication was approved by the FDA in 2012. Now, shortly after Amarin got the approval for the original indication, they started a multi-year study called Reduce It. This study was to evaluate whether treatment with VASCEPA reduces cardiovascular events in people who already are on statin therapy but have elevated TG levels and other CVD risk factors. It was quite a large study with more than 8,000 individuals enrolled. The last patient, as per the press release in 2016, was enrolled around end of August 2016. So the Reduce It trial compared patients which received VASCEPA in addition to statin and the placebo was basically mineral oil, which later spurred some controversy because some so-called experts claimed that mineral oil actually increased the bad cholesterol, hence the placebo group was exposed to a higher CVD risk and therefore the REDUCE-IT trial was a false positive. However, those claims were quickly rebutted by the real experts. Actually, according to a publication in the European Society of Cardiology, not only is mineral oil often used in clinical studies, but according to their findings, based on available evidence, mineral oil does not appear to impact medication absorption or efficacy or related clinical outcomes, and therefore does not meaningfully affect study conclusions when used as a placebo at the quantities used in clinical trials. And in addition to that, there was a so-called JELIS study, a Japanese study, where basically patients were put on pure EPA on top of statin, while the other group was on statin only, and this outcome was also exceptional because it showed 19% of CVD reductions for those patients which were on EPA plus statin. So it's still a huge number. I mean, the 6% difference with the REDUCE-IT study may have to do with mineral oil, maybe. That's not confirmed, but still 19% is still massive for CVD reduction. Now, the outcome of the REDUCE-IT trial was announced by the company in September 2018, and as I mentioned before, it showed 25% relative risk reduction, and this number was just massive, totally unexpected. And on the day of this announcement, the stock price of Amarin shot up like 300%, I think. It was really that good. Not only because the results were exceptional, but because this news completely changed the story of Amarin, as VASCEPA struggled with poor sales with its original indication. So then the FDA announced the approval of the additional indication for VASCEPA on, it was in December 2019. Now, the euphoria for this additional indication didn't last too long though. In fact, Amarin further down the road lost a patent litigation with against two generic companies, Hikma and Dr. Reddy's, I think was the other one. And even though the litigation concerned only the patents on the VASCEPA's original indication, nonetheless it was clear that that was a major blow for Amarin, as they now are at risk of losing a major portion of their US market, which currently is their only major revenue stream. And Hikma has launched their generic version already. There is a glimmer of hope though. Just a few months back, GlaxoSmithKline or GSK won a lawsuit against the generic drug maker Teva. In fact, the latter sold a generic version of a drug called Correc, And Teva used a so-called skinny label, which basically covered 2 indications of CORAC. However, a 3rd indication was added later on, for which then Glaxo still held the patent, and the US Court of Appeals ordered Teva to pay around 200 million for lost profits back to Glaxo for the patent infringement case. That might be a small glimmer of hope for Amarin, as the Hikma is also on a skinny label right now, but they may market their generic for CVD reduction as well, or maybe not directly market it as a CVD reduction drug, but indirectly profit from that additional indication. And I'm also convinced that the generic version of Hikma is of lower quality, based on the fact that Amarin still holds the encapsulation patent. This is also important because the generic version has a different composition and reduces the shelf life of generic VASCEPA. In fact, a YouTuber posted a video comparing Hikma versus VASCEPA and noted that Hikma's version had a fishy smell, while VASCEPA was mostly neutral. That indicates that Hikma's encapsulation formula doesn't really prevent oxidation. I will put a link of that video in the description if you're interested in seeing this video. But we will have to see how that Amarin versus generic case evolves. So what's in store now for the Amarin and the VASCEPA? According to their outlook, they expect approximately 610 million in revenues for 2020, which is an increase of 42% compared to the full year 2019. That in itself is quite remarkable for the company with a market cap of just only 2.5 billion. I always say, if this was a technology company, it would be worth 10 times more at least. And then they have 550 million in cash and no debt. Mind you that this revenue number, as I mentioned before, may have even peaked already because of the generics entering this market. But what keeps me invested in VASCEPA or in Amarin is the opportunity I see in the rest of the world. Europe alone has the potential to become a blockbuster market with more than $1 billion in sales, and China can be another huge market, as Amarin mentions in that outlook. Europe approval is expected in early 2021, with the first launch planned in Germany. They expect they target approximately 200 employees in the European commercial team by end of 2021. As for the rest of the world, especially China, the Chinese Society of Cardiology just included iconsapent ethyl in its guidelines for primary prevention of cardiovascular diseases. That is great news for VASCEPA, with China having more than 290 million people reported to have cardiovascular disease. This may be a huge market for VASCEPA. Then as for additional potential additional indications of VASCEPA, those include plaque reduction. That is a study, evaporate study. They reported 17% reduction in plaque volume in patients with coronary atherosclerosis treated with VASCEPA, also remarkable. Then they have potential uses in COVID-19 to mitigate the effects of COVID-19. We will have to see as well how that evolves. For me, it's clear I will remain invested. If we go back to the chart here, it's we've seen it bottoming here at around 350 level. I mean, I remain invested because I'm intrigued about the potential of VASCEPA, and I intend to stay long. Have a high conviction that VASCEPA will be approved in Europe soon, and that will propel the stock price higher. China may be then the next catalyst. As a reminder, the loss of patent protection for its original indication concerns the US market only and not the rest of the world. So here you can see the stock price has been moving higher since beginning of November, probably in expectation of the approval in Europe. There is a resistance level around the 8-ish level, and on approval I think we may break through this resistance level and go back higher around the maybe this 14-ish level, but yeah, we will have to see how that goes. As for the risk factors to consider, as I mentioned before, VASCEPA is the only product of Amarin, so the company heavily relies on the success of VASCEPA. Short-term risk obviously is maybe a non-approval in Europe. This will most certainly kill the stock, and also the COVID-19 situation, which hinders the sales efforts, as the salespeople can't go directly to the doctors to promote VASCEPA. Other risk factors you may want to consider. I mean, if VASCEPA gets the approval in Europe, the company may require to raise more cash for promoting VASCEPA. I mean, these salespeople are not working for free, so you may expect a raise of capital after the approval. But yeah, I remain confident that VASCEPA is going to be quite successful in the rest of the world, and we have to see in the US how that evolves with the generics, because the generics may not have the supplies required to actually make more of or win more market share in the US. So we'll have to see how that evolves. So yeah, okay guys, Thank you very much for watching. I hope you enjoyed this video. If you liked, please do not forget to subscribe, hit the like button, and hit the notification button if you want to be notified as soon as I upload a video. I do not have a fixed schedule on when I upload videos because I have a full-time job, so for sure you will not see me uploading a new video every day, but I will try to do one every week or maybe 2 per week. We will see. So thank you again, and see you next time.